Advance Directives. If you are injured or ill, your healthcare team will ask you to make decisions about the type and amount of care you want to receive. This includes when your health problems are serious. There are times when you may be unable to share your healthcare wishes. This could be due to sickness or mental confusion. If this happens, it is helpful to have completed legal documents called Advance Directives that state your healthcare wishes. Some documents let you name someone to make healthcare decisions for you. Other documents let you give directions for the type and amount of medical treatment you want in certain situations. These directions can be simple or detailed. When possible, it is best to complete Advance Directive documents before you become sick, when it is easier for you to explain your healthcare wishes to those involved in your care. When you have an Advance Directive, it is important to know that your healthcare team will continue to provide you with the highest level of care possible, including treating pain or other symptoms that may cause you discomfort. Advance Directives can be completed by anyone age 18 or over. These legal documents are only used if you are unable to share your healthcare wishes. This can happen when you are very ill, mentally confused, or under anesthesia. There are different reasons why people complete Advance Directive documents. Some reasons include: there may be certain medical treatments you do or do not want if you have a low chance of survival. An Advance Directive gives you a chance to share your wishes in a legal document. In addition to these documents, it is also important to talk with your doctor and loved ones about the type of healthcare you want to receive if you become seriously ill. These conversations may feel uncomfortable, but they can be very helpful for anyone involved in your care, including your loved ones. Your loved ones may find it hard to make medical decisions for you if they do not know your wishes and beliefs. Completing these legal documents can make it easier for them to make healthcare decisions on your behalf. There are different types of Advance Directive documents. Each can be used in different healthcare situations. You may choose to use one or all of these Advance Directives to state your healthcare wishes. This video will talk about the most common type of Advance Directive documents used in the state of Ohio. Healthcare given in other states may use different types of Advance Directives. It is important to check with the state where you get healthcare for more information. In Ohio, the most common types of Advance Directive documents include a living will, a healthcare power of attorney, an Ohio DNR, Do Not Resuscitate Order, and a donor registry enrollment form. Let's go over each of these Advance Directives in more detail. A living will is one type of Advance Directive that can be used when you are not able to share your health care wishes. It states the type of health care you would choose if you become ill with a terminal medical condition. A terminal medical condition means you are nearing the end of your life due to a disease, illness, or have an injury that is life-limiting with no cure. A living will can also be used when you are permanently unconscious. Permanently unconscious means you are not awake, aware of yourself or what is going on around you, and certain medical tests show that your mental abilities will not return. A living will gives you the ability to state that you do or do not want certain medical life-sustaining treatments. These are treatments that may act to extend life. Some of the treatments listed in the living will include if you want CPR, or cardiopulmonary resuscitation, such as chest compressions provided, use of feeding tubes, or other medical care you may want to receive or refuse. This is not to be confused with a will. A will is a different type of legal document that is used to tell how you want your estate or personal items distributed after death. A healthcare power of attorney, sometimes also called a durable power of attorney for healthcare, is another type of advance directive that lets you name who will speak for you if a healthcare decision is needed, and you are not able to share your healthcare wishes. The person you name as your healthcare power of attorney is able to talk to your healthcare team and make decisions to accept or refuse medical treatment for you. These decisions should be based on what wishes you have shared with your healthcare power of attorney in case of your illness or injury. This type of advance directive can be used during short periods of time when you are not able to speak for yourself, such as during surgery or after a car accident. It can also be used for longer periods of time if you have an illness that causes ongoing confusion or a long period of being unconscious. It is important to know that a healthcare power of attorney is different than a financial power of attorney. A financial power of attorney is when you choose someone to handle your bills or manage your finances. The Ohio DNR, or Do Not Resuscitate, Advance Directive is different from other advance directives, as it is not completed by you. Your doctor, advanced practice nurse, such as a nurse practitioner or clinical nurse specialist, or a physician assistant, completes this healthcare order based on the treatment wishes that you have shared with them. This order tells members of the healthcare team, including those who respond to emergency or 911 calls, about how you want to be treated if your heart would stop beating or you would stop breathing. This order can be used within Ohio in your home, in hospitals, nursing homes, or other skilled care facilities by home healthcare agencies or in other healthcare settings. You must make a choice between two options when using the Ohio DNR form. One option is the DNR Comfort Care, or DNR-CC. The other is the DNR Comfort Care Arrest, or DNR-CC Arrest. Talk to your doctor, advanced practice nurse, or physician assistant about the difference in these two options to make sure you understand the options and they understand your wishes. Since the Ohio DNR form can be used in emergency medical situations at home, it is very important to have it clearly displayed within your home or where it can be found quickly. The Donor Registry Enrollment Form is an advance directive that states your wishes to donate any or all of your body organs or tissues at the time of your death. In addition to keeping a copy for yourself, this document should also be on file with the Ohio Bureau of Motor Vehicles. You should see a symbol on your driver's license to show you are an organ donor if that is your choice. Your wishes about organ donation can also be shared as part of your living will document. Each advance directive has important uses, but also has limits in certain situations. It is important that you fully understand these legal documents. A lawyer is not needed to complete advance directive documents, but it may be helpful to meet with one to review these documents and make sure all of your questions are answered. Ask your healthcare team or lawyer about any special instructions for completing an advance directive. For example, certain advance directive forms, such as a living will or healthcare power of attorney, must be witnessed or notarized. It is always important to talk to your family and caregivers as you are completing any advance directive document to help them understand your healthcare wishes. After the advance directives are completed, they must be kept in a safe place where they can be easily found. These documents should be copied and shared with your lawyer, doctor, healthcare team members, clergy, and any loved ones that may later care for you. Always bring a copy of your advance directives when you go to the hospital for a surgery or medical procedure, and when you plan to see a new doctor. Advance directives are only helpful if others know that you have completed them. Advance directives do not expire in Ohio. You should review your advance directives often to make sure they are in line with your health care choices. At any time, you can tell members of your health care team that you want to cancel an advance directive if it no longer reflects your wishes. You can then complete a new advance directive that states your new wishes. If you do update an advance directive, remember to give an updated copy to your lawyer, doctor, hospital, or clinic where you receive care. The old advance directive documents should be shredded or destroyed. If you are being cared for at the James and want information about advance directives, please ask your doctor or other member of your healthcare team for more information. We have someone who can help to answer your questions and give you information to take home to review. We hope this information has helped you to better understand why advance directives are an important part of your healthcare planning. Write down any questions you might have for your healthcare team and bring them with you to each appointment. We are honored to care for you during your cancer treatment. Thank you for choosing the James.